Welcome to the COVID-19 Compliance Officer course brought to you by OHSS Savvy Consulting. In Section 3, we will discuss two of the following items: changes to normal workplace practices, which includes 1. Physical distancing and workplace or work time adaptation. Number 2. PPE, facilities and related factors. Number 3. Technology to consider such as screening and access systems. Number 4. Client and visitor management. And lastly, attendance and absence management. The second item is communicating and implementing the return. Changes to normal work practices. The term new normal gives us an understanding that we have moved into a new way of providing services to our clients. This brings with it certain necessary changes that need to be made in order to ensure every person we meet is kept safe, and that all prevention methods of spreading the SARS-CoV-2 virus are adhered to. Let us take a look at some work practices that need to be redesigned, changed, or altered to suit this new way of working. Physical distancing and workplace or work time adaptation. Physical distancing. Every employer must arrange the workplace to ensure minimal contact between workers and, as far as practicable, ensure that there is a minimum of 1.5 meters between workers while they are working, for example, at their workstations. This means you can place down signage, posters, as well as physical settings to show the 1.5 meter social distance rule. Should the tables be arranged that we have persons sitting right next to us, we can skip one place and alternate the adjoining tables. If it is not practical to arrange workstations to be spaced at least 1.5 meters apart, the employer must arrange physical barriers to be placed between workstations or erected on workstations to form a solid physical barrier between workers while they are working, or if necessary, supply the employee free of charge with the appropriate PPE based on a risk assessment of the workplace. Workplace or work times adaptation. Every employer must ensure that social distancing measures are implemented through supervision both in the workplace and in the common areas outside the immediate workplace through queue control, or within the workplace such as canteens and lavatories. These measures may include dividing the workplace into groups or staggering break times to avoid the concentration of workers in common areas. Depending on the circumstances of the workplace or the nature of the sector, the minimum distance may need to be longer. Reducing the number of workers present in the workplace at any time may assist in achieving the required social distancing. This means that we must, as far as practicable, minimize the number of workers at the workplace at any given time through rotation, staggered working hours, shift systems, remote working arrangements, or similar measures in order to achieve social distancing. PPE, personal protective equipment. The general requirement for workers to wear masks does not take away from the fact that, where a risk assessment indicates that PPE is required, those categories of workers must be provided with the accredited PPE in accordance with the Department of Health guidelines. PPE should be supplied at no cost and must be issued as part of the risk assessment. Every employer must check regularly on the websites of the National Department of Health, National Institute of Communicable Diseases, and the National Institute for Occupational Health whether any additional PPE is required or recommended in any guidelines given the nature of the workplace or the nature of a worker's duties. What personal protective equipment are we talking about? First of all, are your COVID-19 masks. Every employee is required to have a minimum of 2. Then, the appropriate gloves, dependent on the task that you are performing. Face shields and visors, as well as others that are recommended via the websites spoken above, or the risk assessment. Facilities. All employers must ensure that there are adequate facilities for the washing of hands, equipped with soap and clean water. Only paper towels are provided to dry hands after washing. The use of fabric toweling is prohibited. Ensure that workers are required to wash their hands and sanitize their hands regularly while at work. All workers interacting with the public are instructed to sanitize their hands between each interaction with public. All surfaces that workers and members of the public come into contact with are routinely cleaned and disinfected. Ventilation. Every employer must keep the workplace well ventilated by natural or mechanical means to reduce the SARS-CoV-2 viral load, and where reasonably practicable, have an effective local extraction ventilation system with high efficient particulate air HEPA filters, which is regularly cleaned and maintained, and its vents do not feed back through open windows. Employers are to ensure that filters are cleaned and replaced in accordance with the manufacturer's instructions by a competent person. Certain technology is to be considered, such as symptom screening. Every employer must take measures to screen any worker at the time that they report for work to ascertain whether they have any of the observable symptoms associated with COVID-19. These include fever, coughing, sore throat, redness of eyes, or shortness of breath. Ensure and require every worker to report whether they suffer from any of the following additional symptoms: body aches, loss of smell or loss of taste, nausea, vomiting, diarrhea, fatigue, weakness or tiredness, and require workers to immediately inform the employer if they experience any of the symptoms while at work. Another piece of technology to consider is access. To ensure that you prevent the spread of the SARS-CoV-2 virus, you may need to deactivate the biometric systems. Buttons on elevators may need to have additional protection, or a person manning the elevator. Every employer must take measures to ensure that all work surfaces and equipment are disinfected before work begins, regularly during the working period and after work ends. All areas such as toilets, common areas, door handles, shared electronic equipment are regularly cleaned and disinfected. Disable biometric systems or make them COVID-19 proof. Client and visitor management. The principal purpose of the measures contained in the C19 OHSS regulations is to protect workers from being exposed to the virus through their interaction with the public, and to protect members of the public from being exposed to virus through their interactions with workers or other persons present in such a workplace. Public access. Depending on what is reasonably practicable given the nature of the workplace, every employer must arrange the workplace to ensure that there is a distance at least 1.5 meters between workers and members of the public, or between members of the public, or put in place physical barriers or provide workers with face shields or visors. If appropriate, employers are to undertake symptom screening measures of persons other than employees entering the workplace with due regard to available technology and any guidelines issued by the Department of Health. Where appropriate, display notices advising persons other than employees entering the workplace of the precautions they are required to observe while in the workplace. Employers are to require members of the public, including suppliers, to wear masks when inside their premises. When an employee tests positive for symptoms, what do? Immediately isolate the worker. Provide the worker with a FFP1 surgical mask and arrange for the worker to be transported in a manner that does not place other workers or members of the public at risk, either to be self-isolated or for a medical examination or testing. Attendance and absence management. All employees, regardless of where they work, from the office, on the road, at home, or other areas, need to sign a register for screening as well as attendance. When employees move from one place to the next, it is important to know these movements so as to ascertain when and where employees were. This is to keep accurate records for potential contact tracing. All visitors should be screened, and this can be used as an attendance register of those who are visiting your offices. Should the need arise, compliance officers can use this to communicate with members of the public in order to inform them of a potential exposure. Communicating and implementing the return. All transactions result from communications. Good communication skills are essential to allow others and yourself to understand information more accurately and quickly. In contrast, poor communication skills lead to frequent misunderstanding and frustration. Communication is an important management function closely associated with all other managerial functions. It bridges the gap between individuals and groups through flow of information and understanding between them. Use the resources at hand to create safety talks, toolbox talks, inductions, and orientation days. What is important is communicating the requirements of the protocols and company policies in a way that engages the listener and encourages active participation. You may also need to use non-verbal communication. This can be in the form of posters, signs, policies, risk assessments, procedures, text, and emails. Implementation. What must you do? Document all procedures. Ensure you cater for high-risk employees. Change the way you work through staggered working hours or days, rotational work, or working from home. Get it done at the office, vehicle, or home that you are working out of. Keep a schedule of registers and checklists to complete and have a good reminder on your to-do list. Register for CMOR and report if necessary. Supervise, monitor, and review. Let's recap. Changes to normal working routines will include physical distancing, workplace or work time adaptation, personal protective equipment, facilities, screening, access systems, client and visitor management, as well as attendance and absence management. Employers are required to ensure protocols are adhered to by employees and visitors by verbal and non-verbal means. Employees must have a routine of COVID prevention protocols such as hand washing, disinfection, and sanitization. As a COVID-19 compliance officer, you are to supervise and monitor the controls in place to ensure adherence to the C19 OHSS regulations and keep up to date with what additional protocols may be needed by checking the National Institute for Communicable Diseases or the National Department of Health websites. A COVID-19 compliance officer should check all aspects of the COVID-19 management plan to ensure all areas are covered. Keep a good schedule and use technology to your advantage by ensuring you are reminded day by day of what is needed. Well done on completing Section 3 of the COVID-19 Compliance Officer course. Please wait for Section 4 link to be sent through to you.